Pharmaceutical pricing remains one of the most contentious issues in modern healthcare systems across the globe, but nowhere is this more apparent than in the United States. The cost of medications has soared to astronomical levels, pushing the limits of affordability for many individuals and threatening their economic access to essential medicines. While the pharmaceutical industry argues that high prices are necessary to fund research, development, and innovation, the reality for many patients is a growing divide between the availability of life-saving treatments and their ability to pay for them. The impact of high pharmaceutical prices is not only felt by those without insurance, but also by those with insurance coverage, who often find themselves shouldering substantial out-of-pocket costs. Insulin, for example, has become emblematic of the pricing crisis in the U.S. The price of insulin has more than tripled in the past 2 decades, leaving millions of diabetic patients facing crippling financial barriers. This has led to countless individuals resorting to dangerous measures, such as rationing their insulin or going without it altogether, simply because they cannot afford the cost. The result is a public health disaster, with people suffering and dying needlessly from preventable complications. The problem with pharmaceutical pricing is compounded by the lack of transparency in how prices are set. The process by which drugs are priced is often opaque, with pharmaceutical companies setting prices without sufficient oversight or regulation. There is little accountability in terms of how much it costs to produce a drug versus what it is being sold for, leaving consumers vulnerable to being charged exorbitantly. The justification often given for such high prices, namely, the need to recoup the costs of research and development, fails to account for the fact that much of the funding for drug development comes from taxpayer dollars and public grants. In many cases, drugs that are marketed at enormous prices have been heavily subsidized by the government, yet the public still faces the full financial burden. Moreover, the concept of price gouging is a growing concern in the pharmaceutical industry. Companies routinely increase prices by double-digit percentages year after year, even for drugs that have been on the market for decades. This price inflation affects both generic and brand-name drugs. With no effective price controls or regulations in place, pharmaceutical companies are free to set whatever price they choose. This situation is particularly harmful for low-income patients and those in marginalized communities who may not have access to the resources necessary to afford these medications. For those without insurance or with inadequate insurance, even relatively low-cost medications can become unaffordable. The widening gap between drug prices and the financial means of the average consumer is especially problematic in a healthcare system that ties access to medicine to one's ability to pay. For example, certain cancer medications can cost upwards of $10,000 per month, a price that most families simply cannot bear. In a system that claims to provide care for all, this creates a stark and unforgivable inequality. Those with means are able to access cutting-edge treatments, while those who are economically disadvantaged are left with limited options, often resorting to the cheapest, least effective alternatives, or none at all. While insurance coverage can offset some of the costs, it is far from a perfect solution. High-deductible health plans and restrictive formularies often limit access to essential medications, even for those with insurance. The reality is that many patients are forced to choose between paying for their medications and covering basic living expenses, leading to difficult and heart-wrenching decisions. Studies have shown that a significant portion of people who are prescribed medications do not take them as directed, either due to the inability to afford the drugs or because the cost of copayments is prohibitively high. This can lead to worsening health outcomes and a greater financial burden down the road as individuals require more expensive care when their condition deteriorates. Another troubling aspect of pharmaceutical pricing is the manipulation of the market through tactics like pay-for-delay agreements. These agreements allow brand-name drug manufacturers to pay generic manufacturers to delay the release of cheaper generic versions of their drugs, thus keeping prices artificially high for longer periods. Such practices serve to prolong monopolies on essential medications, preventing more affordable alternatives from entering the market and exacerbating the financial burden on consumers. Despite the well-documented harm caused by these practices, regulatory bodies have done little to prevent them, leaving consumers to suffer. The focus on profit within the pharmaceutical industry has increasingly come at the expense of patient care. The growing dominance of large pharmaceutical corporations has shifted the industry's priorities away from improving public health to maximizing shareholder profits. This shift is especially evident when companies push for exorbitant prices on new drugs, even when they provide little improvement over existing treatments. In some cases, companies have been known to manipulate the patent system to extend their monopoly over a drug, thereby ensuring that the price remains high and competition is stifled. The economic access to medicine issue is not simply a matter of cost. It also has significant consequences for the broader healthcare system. When patients cannot afford the medications they need, they often experience worsening health conditions that require more extensive and costly interventions down the line. This creates a cycle of escalating medical expenses as patients end up requiring emergency care, hospitalization, or more complex treatments as their untreated conditions worsen. In the long term, the failure to address the affordability of medications may lead to a public health crisis of greater magnitude, as the number of individuals requiring high-cost treatments increases. The lack of regulation and oversight in pharmaceutical pricing is a dire problem that demands urgent attention. Without action to control prices, ensure transparency, and promote the development of affordable alternatives, millions of Americans will continue to face unnecessary suffering and financial ruin simply to stay alive. The current system, in which profits are prioritized over people's well-being, is unsustainable and unethical. The time has come to reevaluate how we approach pharmaceutical pricing to ensure that access to life-saving medications is a right, not a privilege reserved for those who can afford it.